All right. While I'll be presenting, I will also tell my story of how we have been here, and how I have promised for you, and how we will be talking that how I stayed naturally healthy for at least 25 years and still live pill free. Um, and that is exciting, of course, for me, but I want you to be excited too. And that's why I say how you can stay naturally healthy for years to come and still be pill free. And that is exactly what this presentation is all about, and what InnerPath is all about, that we do. So my goal for you is a clear decision framework of what to do, what to watch, what not to watch, and what methods to use to create your autopilot system at home and with yourself, so that then you can go ahead and let it run for you. And simple home plan, as well as red flags, when to take action, when to take action towards homeopathic medicine, when to manage, and when to go towards experts, and as well as stay consistently healthy for years to come. That is my promise, and I will keep my promise during this presentation. Now, who is this presentation for? Before we go forward, this presentation is for parents, caregivers who want safe, natural options, whose families are tired of the pill for everything cycle situation that has happened and unfortunately has developed. For people who want a framework, not a random tip here and there from this person, that person, something that is solid, something that you can count on. And for anyone who wants to confidently use homeopathic medicine, as well as with expert backup system at their home, this is for you. Now, also, that's important to know who is this not for. It is not for anyone who's looking for magic cures or instant results, or anyone unwilling to learn basic safety boundaries, which we will be talking next day about basic safety boundaries, and we'll be talking about that in detail. Anyone wanting to replace emergency or life-saving care, this is not for you, because the system of emergency care and life-saving system that we have here in the United States is perfect. They work on their field great, diligently. I think it should be used. But for chronic diseases and acute diseases, this is for you. So the story behind InnerPath. I didn't build InnerPath just a business idea. Before this, I have endeavors. I still have business endeavors that are running, but I built it because families really needed a better system. Throughout the time that we worked in InnerPath, and now this the new form of InnerPath, um, we were going based on single consultations. Of course, you know what the charge is from single consultation, anywhere from $150 to about $900 per consultation. Of course, we as InnerPath members did not charge that. We went to the middle, and still are in the middle somewhere for our one-time consultations. But we totally changed to reshape the whole idea, because every time people would come to us, they would think, rather than they would watch, we would watch them struggle, they would watch to their pockets, and not come for the financial reasons, not get the right help for the financial reasons. So I was forced to ask myself this question: is there a better way? Is there a way that I can offer homeopathic medicine, still not burden the financial, the pockets, out of pocket situation? Then I had to really study the medical care model and how it operates, and how such high costs, how these they're still nonprofit and still have these bigger buildings, and they're working on. So that was in my mind when I came to the United States. But this time, then it around 3 years ago, I really started digging into it. So I came to know about how insurance operates, how what are HMOs, what are the low cost, more rules situation type of organizations that are health maintenance organizations. they ask you to stay in the network and choose primary care. And whenever you go to a specialty, you need primary care referral for that. You often cheaper, mostly cost. In some of them are costly, but mostly cheaper. Often they're predictable and they're managed care. They're working on the management of or maintenance of care. Then I came to know about PPOs, preferred provider organizations, more freedom but high cost. You have in network, you have out of network, their network, whichever insurance you take. There were no referrals needed whenever you go to anywhere. Of course, people who are traveling, that's a plus for them, because you could get sick anywhere, so you can get help from any place. And faster access to specialists, because now you don't have to wait for 2-3 weeks or months. So you can get into your primary, and primary will give you another referral for a specialist, and then you don't know when will specialist give you. I think that is laughable at this point of what type of system is being used. But I think we can counter that. And there are higher premiums and for PPOs. Now, I'm here not to teach you, not to teach you here insurance, but to tell you a little bit of what I found. When I said that, okay, I can do that. If they can do for disease management, what is there for health management? How we can help public to get into health management so that they can manage and they can benefit from homeopathic medicine while managing their health rather than getting to disease. So we came about an idea of a membership program called Ascend program. So I named it IAP, which you heard me saying PPO and HMO. Now this is IAP, which is Interpath Ascend program. It is focusing on wellness, guidance, and root cause support of the situations that people face. So it is a membership style wellness, not an insurance. Again, we ensure you that you will be having access to our practitioners. So the education is there, a part of it. That's what the mini part of what we are doing now currently for you here through this program is education, personalized plan, and ongoing support will be there by the practitioners who will be your practitioners. And if they're not available, there are practitioners who will take over charge. And then our emphasis is on homeopathic medicine, which basically in Hahnemann's term, helpness, but that means lifestyle, nutrition, and homeopathic medicine all together, because that is what we do. So that is our focus. Best for people who want to have results, not follow too much rules and regulations, but want results and long-term healthcare ownership. And because we will teach you most of the things that anyway you will be going out and buying or purchasing synthetic medicine, which is always not good, and at no point our body needs synthetic drugs that are created in lab. And you know it, of course. I know it, everyone knows it. So this works alongside. This is not that HMOs are bad, PPOs are bad. We are working alongside with HMOs and PPOs so that then we can help them help their clients to reach their health goals. Not replacing HMOs or PPOs. Those are insurances. Of course, we are not insurance. Again, that distinction has to be there. Now, not only that was the problem, there was also, we felt and found out from our clients that they're actually doing another thing. When there's a panic, they Google, they guess, and they suppress. You know what I mean, right? You Google, and some Tom, Dick, and Harry somewhere has written something, and Google pulls out that, and then they will go by it without knowing this is credible source, not credible source. Of course, when you do not have access, or where there is a block of access for the healthcare industry, then you have to do that, whatever you do. I don't blame anybody, but this has happened. That was a problem that we found. And then in our side of the matters, where the pay per visit was also a pressure. Now you can't be asking everybody or anybody for that type of $900 or 500 or 400, any matter, maybe $100 per visit, it will be problem. It will be devastating for their financial challenges that they have. So we sensed these two things, and there was, even if people were going there or coming to us, there was no framework. There was nothing after consultation that we can teach you, and you can carry on, and you can help yourself. And it was based on each consultation. Now, people, of course, we know that they don't lack options for help. There are a bunch of organizations, hundreds of organizations for help. That is not the lack. Lack is affordability, clarity on things that needs to be done. What is health? What is disease? How I can take care of my health so I don't end up being diseased. We have seen situations. One of my clients indicating that they were waiting for 3 years for them to actually find out a problem so that then they can solve it, because they couldn't find through. Remember the idea of Dr. Hahnemann, that the criticism that he had on that time of medicine, that too much reliability on relying on the matter of chemistry, and too much on lab work, and you can't find anything in lab. What can you find in medical mental situations in lab? What can you find in emotional situations in lab? Yes, there will be imbalance, of course, but the imbalance is internal. It's not external. You can't create or fix that by giving somebody extra synthetic drug that you have created in the laboratory. That was what he criticized at that time, and still that is what we see the similarity here. So the system is geared for profits from complexity and speed. It's not for empowerment, and not as we have seen this. So we created a different vehicle. We created a system that is geared towards 100% opposite. Of course, allopathic medicine is opposite to homeopathic medicine in terms of the name. That's why we created this system, new opportunity, that you will have unlimited access to your practitioner. You will have empowerment along the way. This is affordable membership that combined together, this becomes a system, a simple system that can help one individual, their family, and going forward, passing it on to everyone around them so that they can help their community. That is what we created, and now that we will explain in 3 secrets to you. Secret number 1 is health on autopilot. You will learn with a simple 3-step natural framework, so that you can follow and let your life run automatically while you're taking care of all other things in your life, rather than taking care of all the appointments in life, right? So who doesn't want that? Everyone. Family first responder. Not only you will be healthy, but also you will help your family through the workshops that we will be doing, and through the support that we have, ongoing support that we have. You will handle everyday issues calmly and safely, without panicking and without challenges. And secret number 3, unlimited access to experts. So you always feel supported. Yeah, and there is no restriction in that. So health on autopilot. So we will build conditions. We will help you build conditions where the body self-regulates itself without any synthetic dependency. I mean, it's common sense, right? What we do is we remove the overload. Whatever overload is from external or internal on our body, that is clearly, again, the body is communicating to us, we remove that. How do we do that? Step number 1, how to remove overload. You simplify your food. Too many complex things, currently, that any type of food you pick up anywhere in the restaurant, rather than having a simple 2-3 recipe, 2-3 things in there, you will have 27 things. French fries, last I checked, we had 27 ingredients in one French fry. So how do you think, food is not impacting? It is a signal to our body, not only nutrition, but also signal. It will reduce overstimulation. It will reduce, all the overstimulation that is happening already in our body through the stress. And then it will restore the sleep rhythm. and by hydration, you can actually accelerate that. It's a very simple understanding of your health. And then our health runs on a pattern, and you observe patterns in your life. You give you a tracker which is called health on autopilot. You do the tracking system, and you improve in what you actually, what symptoms are improving and what are worsening. You track those. That is the best information that you can give your practitioner, so that then they can help you what is going on with your body. And then general body support, which is creating routine, following guidance from your expert, and avoiding blind suppression. Any headache, one headache might have 3, 4, 5, 10 reasons for it, while we don't know what is going on, but we suppress the headache because you're feeling that there is pain in there. But you need to know, yes, suppressing is to a point, has its place, but at the same time, you should know what is the root cause of that situation to solve it completely, rather than just masking it and then ending up into another place. Okay, and then secret number 2, family natural health first responder. We will help you respond to the everyday challenges calmly without any medical background. You don't need to become a medical expert, so you can help your body and your family's body. We will help you in that. So many people might think that I need 3 years of education, 5 years of education to help myself, my family. I need this certification, that certification. No, I think you need belief, and that you're not powerless. You need awareness. You need a plan to follow. Not all the certifications that are there, they're good at their point, but at the same time, it's not necessary that you have all the certification before you help yourself, your own body, because you know your body better than anybody. So the first step is recognizing what it is. What is the problem? How intense it is, and is it improving or is it worsening? The first is to find out what is the problem, and next is support it with basic management of that specific area. We have that presentation that we will be doing on the third day about basic management of the daily situations. Staying calm and having a simple plan of A, B, C, D, you have to do this. D, E, F, you have to do that. Very simple plan put together, so then you can get the help. And then escalation. You know what are the green flags and what are the red flags, and when to seek medical help and when not to. And there will not be any hesitation, and we will clarify everything. Now, unlimited access to experts. Once you're an IAP member, you will have unlimited access to experts. How families stay consistent is the way that you have support. If you don't have support, then it will be challenging to keep up with things that you have started. What sustains your health? It's not motivation, it's ongoing guidance. It's a community of like-minded people going in one way, which we will provide, and these small wins will stack consistently on one over each other, so that then you can work on that. Now, the inner path, the vehicle for you is the Inner Path Ascent program, which I indicated, IAP program. It will give you access. It will empower you. It is affordable, combined with everything, all the mentorship model that we have, which is support model from your expert, will help you, be calm, will help you run your health, or take ownership of your health and your family's health. So what is it that we offer in IAP? We have unlimited access to experts, appointments, messaging directly without any hurdle. You will send your opinions, your situation, tracking your progress, and a team behind that will actually respond to your needs. And then the next thing is our Family Optimal Health workshop. It is 2.0. Not this workshop. This is geared to first aid matters, but that one is geared to a little bit higher matters, so that then you can get educated about most of the challenges that you're facing, or most all of them that you're facing, and you take control of that. And it takes about a while, so that then you can understand and work on that. But monthly, then we will have deep dives into specific situation that you will have access to, and you will learn on a consistent basis throughout the years that the community exists, and we will provide support. And we will have the same situations, the same workshops, as well as deep dives put in a library for you, as well as the community that will be helping you, both sides, from the side of the experts, as well as the community that are actually getting help from the experts, so that we can move along. So what this replaces, the IAP replaces per visit stress. Every time you have to go and set up an appointment, you have to pay for it, right? And usually, as I said, it is more than what an average family can afford or will afford. But it's hard. They could reroute that money somewhere else, so that then you can help your life and your family. Every question feels expensive, just like you're going to consult from any type of other profession. Dr. Google guessing and late night panics will not be there anymore. This replaces that. Waiting for weeks so that you can get an answer, or waiting for weeks so that then you can get into an appointment, it will solve that. Any synthetic quick fixes, it's all natural. Homeopathic medicine is the key for that. We use that, so it replaces that. What was the old situation? The old situation was $150 to about $900 per visit that you have to pay. And in InnerPath, we are in the middle, $450 that you had to pay in our previous model, which currently exists. If somebody wants to go there, we're okay. We want to help them. And you would hesitate for that to ask questions. And what will happen? Do I have access? I don't have access? Is in my one appointment, can I figure out all what I need to figure out? No education was there. There's no education that will tell you what to do, what not to do, and how you can take care of yourself as well as your family outside that appointment that you have and consultation you have. Of course, that is profit-based model, and and I know it. You're alone at home, of course, all the time. And the only time you access your practitioner is the time that you go there. But InnerPath model, IAP model, is one predictable membership. It's $29.99 per month that you'll pay, and you have full access to all your practitioners that you're a part of. Ask your practitioner whatever without any hesitation. It will be 24/7. You have access both ways. Schedule many appointments. No problem. Unlimited appointments. At each appointment, you just pay a $10 visit, not $400. And so it reduces the cost to 100% down, about 89% down. So that you have access, you have affordability, you have empowerment to your health, and you have ownership to your health. Besides, the education will empower you, monthly content that you will be getting, and then guidance and community support that you will have, guidance from your experts and community support from like-minded individuals who are gaining help. Now, just to say, okay, what if it didn't work for me? Well, try it out. Try our service for 30 days. If it's not a good fit for you, you can request a refund. No pressure at all. Now, what are the plans? How do the plan look like? We have 4 plans. It's not based on how much you get. No, it's based on individuals. It's based on quantity. It's not based on quality. Quality remains as it is for all these plans. So no quality problems. All right. Your basic plan, your golden plan, and your platinum. There's nothing like that going. We pay equal attention to everyone who comes to our doors, and that is our motto. And then plan A1 is for one individual. An individual wants to have their support from InnerPath. It will cost them $29.99 per month, and per year $359. It's actually $1 and less per day. In investment in your health. Annual visits are unlimited. You can have as many as visits you have. Your second visit will cost you that $10 copay that you will pay. The rest of it is on InnerPath. And then the first initial remedy is covered. Usually it takes a month or 2 months to finish the remedy, so that then you can start working and most probably in a month or two, healing will happen in most cases that are not 100% chronic and multiple years. Now, the next plan is more exciting than the first plan. The second plan is plan owner and the children. If you are single mom, single dad, there's 18% off from already that you have. If you were to subscribe as a two individual, a child and a dad, a child and a mom, then it will double the price, right? That will become $60. But no, we reduce the price 80% for you so that you have access to that. So your families, again, remember, our focus is on families, so that then we can help them. Once we have ground support from families and everything, so you will be supported from our side. You will support us on both ways. So $39.99 per month. That will be $479 per year. That is annual visit. Again, same quality, unlimited visits. From the second visit onward, you will pay your copay, and then initial plan or initial session that will be there, the remedy is covered for you. So that is that. And then another excitement, your spouse and yourself. So an individual with spouse, which means a couple. So a couple, two individuals, you have more chances of discounts. There you have 20% lower than the first or initial plan. See how we encourage families to be a part of this, so that then they can help themselves as well as their family and people around you. So that will cost you, if we do it the double way, which is if you're two, then it becomes 60. But here we have reduced it to $49 per month, and that is $569 per year. In other case, you will pay one individual for any type of insurance, or most of them, per month. But of course, we are not insurance, and we don't want to claim that we are insurance. We are actually membership that want to have access or give you access completely to a practitioner, homeopathic practitioner, as well as unlimited visits. We do not stop you anytime. And your second visit onward, you will be charged $10 copay. You will be covered for initial session for the remedy. Now, here's another exciting plan. Again, our fourth plan is family plan. So as whether you're one person, 2, 3, 5, 10, you're one person, then you're an individual, but you're 2, 3, 5, 10 as a family, you can become a part of our family plan and then save 50%. Basically, rather than paying, if you're 4, rather than paying 120, you're paying 60. Rather than pay, if you're 3, rather than paying 90, you're paying 60 per month. And then your annual charge will be $731.88. So unlimited visits, again, no compromise on the quality, but only the quality of individuals. When they increase, we want to have you as a family. We want to encourage you as a family, so that then your family is totally healed, rather than you only or one individual. That would be as an individual plan. It's better to have everybody, so that they can create the environment for each other and support each other. Your second visit will incur $10, and your first initial remedy is covered. That is what we have for you. Now, this is the special offer in this presentation for you and this event for you. You can scan that code, and you can actually schedule an event. This is not where you pay, okay? This is schedule an appointment, 30-minute appointment, complimentary session for you, so that we can assess what is going on and how we can help you, and we can put forward a plan for you in 30 minutes after understanding what's going on for you, so that we can tell you how we can help you the best way.